Coronavirus, COVID-19. You've heard people talking about coronavirus on the news, at the clinic, and around in your community. Many people are really afraid because they think they can get very sick or even die. I'm here to tell you more about COVID 19 and how you can stay safe. COVID 19 stands for Coronavirus Disease 2019. COVID 19 is a pandemic. This means it's a disease that is happening all over the world. COVID 19 is a new disease, and we don't know everything about it yet. This disease has no cure at the moment. There is no medicine that can make it go away, and no vaccine to stop you getting it. COVID 19 is caused by a virus. Viruses are germs that are so tiny you can't see them. They are also so light they can float through the air in tiny drops of water you cannot see and sit on your skin without you feeling them. If these germs get inside you, they can make you sick. Doctors and scientists around the world are working non-stop to develop a cure and a vaccine. Until then, it is up to you to try not to get infected. We know that COVID 19 can spread easily. These germs can live in people's throats, mouths, and saliva. When someone who has the virus coughs or sneezes, germs come out in tiny drops of water. These can land on door handles, tables, on other people, or just float in the air. When you touch something with germs on it, the germs stick to your hands. Then, when you touch your nose or mouth, or even rub your eye, the virus can get inside and make you sick. If someone is sick with COVID 19 and has been coughing or sneezing straight into the air, you could breathe those germs in and also become infected. Many of us have bodies that are healthy enough to fight the coronavirus, but everyone is at risk. People who have already had a serious illness like cancer, diabetes, or TB can be at a greater risk and not be strong enough to fight the virus. If you have HIV and you're not on treatment, you are also at risk. Older people are at a greater risk and should, if at all possible, stay at home and away from any others who may be sick. Many things about this disease are unknown, with symptoms ranging from mild to very serious, and in some cases causing death. There is no cure. There is no vaccine yet. It is okay to feel worried and okay to feel scared. We should all be very careful in order to prevent catching this disease. Here are some things you can do to keep you and your family safe and healthy. Social distancing means not standing close to other people and, wherever possible, keeping at least 2 meters away from them. By not getting close to people and staying at home if at all possible, we can protect ourselves and our families, and also older people who are at a greater risk of catching COVID 19. If you have to go to the shops, remember to keep your distance and stay away from any groups of people. The more you can be in the open away from other people, the safer you will be. Viruses and germs don't like soap. Carefully washing your hands for at least 20 seconds with soap making lots of bubbles and hot water can kill the germs on your hands. Remember not just to wash your hands, but also your wrists and your arms as often as you can, and after you have touched anything outside of your home or things that are not yours. If you need to cough, sneeze, or blow your nose, use a tissue and throw it away immediately into a rubbish bin or dustbin. Also, wash your hands straight away or use hand sanitizer to kill the germs that are on your hands. You can also cough or sneeze into the inside corner of your elbow. Anytime you leave your home, you should wear a cloth face mask. This is very important when you're around people outside of your household to prevent the spread of coronavirus. Wear the face mask so that it covers your nose and mouth. Remember that touching your face, nose, and mouth is dangerous. Always wash your hands before you take your face mask off. Try not to pick your nose, bite your nails, put your fingers in your mouth, or rub your eyes with unwashed, dirty hands. COVID 19 can cause a lot of different symptoms, from mild illnesses to pneumonia. The most common things to look for are fever and a temperature, dry cough, sore throat, headaches, and tiredness. You may have difficulty breathing or feel short of breath, have chest pain, or feel like someone is pressing on your chest. Remember, there's nothing shameful in becoming infected, and you must not be ashamed of yourself or critical of anyone who gets COVID. If you think you're sick, you must contact your clinical doctor to find out what you need to do and whether you need to be tested. There are community based testing centers and helplines that you can call. Many people recover by just staying home, drinking lots of fluids, resting, and not being in close contact with anyone that they can make sick. If you're having problems being able to breathe, contact your doctor or clinic. In most cases, it takes between 2 and 14 days for someone who has been infected to become sick. This means that you could have become infected by COVID 19 before you know you're going to be sick. If you get sick with only mild symptoms, it'll take about 2 weeks to get better. For those with serious symptoms, it can take up to 6 weeks or even much longer. The only way we can fight COVID 19 is if everyone, everywhere around the world, does their part. This means socially distancing, not getting close to other people or friends, always washing your hands, not hugging or shaking hands with people outside those you live with, and always, always wearing a face mask when you're in public. We are all in this together. If everybody does the right thing, it will make a big difference. Do your part. Stay safe.